Okay, so today we're going to be performing a full assessment of a newborn. The first thing I would do when I enter the room is perform hand hygiene and then raise the bed up to a good working height for myself, which for me is almost all the way up. So this is Mary, our newborn. She's 1 day old. She has already had her ABCs done, so obviously we know this baby is breathing, her vital signs are checked out, so now we'll be moving into the more detailed assessment portion. So the first thing I'm going to do is, because babies are poor thermoregulators, we're going to make sure the baby is in a good thermoregulated environment, so she'll be placed in a warm environment, and then we're going to check her temperature with our thermometer here, make sure it's normal, and then hook her up to continuous temperature monitoring so we make sure that as we're performing this assessment, her temperature stays within an acceptable range. Normal temperature for a baby is about 97.9 to 99.9. So the first thing we're going to do here after temperature is perform a visual inspection of the infant. So we're just checking her posture, looking flexion at the major joints, any signs of like dysplasia, checking muscle tone and posture, checking to see if she can hold her extremities up or is splaying flat. That's more common in preterm babies. We're going to just check for any kind of gross abnormalities, so fingers and toes, any missing limbs, things of that nature. So we've visually assessed the baby at this point. No tremors, jitters, seizures, anything like that. So now I'm going to go ahead and listen to the heart and lungs. So I'll be sure to warm my stethoscope before touching the infant. The baby's quiet. If they're crying, obviously this is a little harder, but we're going to go ahead and listen to the heart sounds first. The normal heart sounds for a baby is 110 to 160 beats per minute, and because it can be irregular, we want to listen for a full minute. And then same for the respiration rates. We want to assess for a full minute because they can have a regular respiration. Normal respiration for an infant is 30 to 60 beats per minute. So we're auscultating for any appetitious breath sounds, making sure to check the size of the chest cavity as well, because sometimes the chest cavity is so small in the front we can't hear everything. So that's done. We're going to do a visual inspection of the baby's breathing, their work of breath, so see if there's symmetrical chest expansion. We're going to check for any nasal flaring, anything of that nature, any signs of respiratory distress, and obviously those breath sounds are clear, you're not having any crackles, squeezing, anything like that. Now that we've performed that visual inspection of the work of breathing, we can go back and auscultate the abdomen for bowel sounds, making sure that you're hearing bowel sounds, and then checking the lips for any cyanosis, blueness. On the extremities, that's not too abnormal, but anything in the core area is obviously cause for concern. That would mean inadequate oxygenation in the baby. So now we're continuing our assessment of the skin. A normal term baby is going to have soft and smooth skin with some deep cracks in the abdomen. You may see blood vessels, may see slightly peeling skin, may see birthmarks. Jaundice is abnormal but not particularly concerning unless it presents for over 2 weeks. We're going to pinch the skin, assessing for skin turgor, just like we would in an adult. You can see different skin conditions, so like milia, lanego, mottling, blanched skin. All these are relatively normal findings, but they should be noted. So now we've done a full skin assessment. In darker skin babies, you might see Mongolian spots over the buttocks, so you want to check for that. So now we're going to move ahead and get some more statistics. So we're gonna go ahead and weigh the baby. When we're weighing the infant, obviously want to make sure everything is off the scale and that the baby is naked, so you're not getting the most accurate weight possible. Normal weight for a newborn is between 5 pounds 8 ounces and 8 pounds 13 ounces, so 2,500 to 4,000 grams. And now we're going to go ahead and perform some measurements. So get the occipital measurement, which is 32 to 37 centimeters, right around the eyes. Chest measurement at the nipple area should be about 2 to 3 centimeters smaller than the head assessment, so 30 to 35 centimeters. And then length. This is a lanky baby, so you want to fully extend the leg, and should be between 48 to 52 centimeters. So now that we've gone ahead and gotten our measurements, we're going to go ahead and start with the head for the head to toe assessment. Palpating the fontanelles. Should be soft, flat, and firm. You may feel some pulsation. You'll feel the anterior fontanelle is larger than the posterior fontanelle. And the hair should be fine and silky if they do have hair. Moving on down, facial symmetry. If the baby is crying, you want to see facial symmetry in their expressions. Noting the placement of the eyes. Edema of the eyes is common. You want to lift the baby's head so they open their eyes. And then at that point, we're going to check for the pupillary reflexes with a pen light. Make sure there's no signs of discharge, jaundice, hemorrhage, anything like that around the eyes. The ears, we want to draw an imaginary line from the outer canthus of the eye to the pinna. It should be straight. Check for skin lesions around the ears. The pinna should be well curved. You want to pinch the ear and then make sure it snaps back immediately. Lower placed ears can be signs of congenital defects, but it could also just be hereditary, so you want to check the parents and see what their ears look like. Then we're going to clap to the side, and the baby should react in some way, either crying or through movement, just to check the hearing. Moving down to the nose, checking for symmetry, and then checking for patency, so making sure the infant's mouth is closed, and then one at a time, including the nostrils, making sure they're breathing through each nostril. The mouth, so you want to evaluate the rooting reflex, so you kind of stroke on the cheek. The baby should follow your finger to each side. Tongue should freely move around the mouth. At that point, you can stick your finger in the mouth and evaluate the sucking reflex. It should suck on your finger. You're looking at the hard and soft palates, making sure those are normal. And the mucous membrane should be pink and moist. You want to assess the oral cavity with a pen light. Make sure you can see back there. You may see Epstein's pearls on the palate, the small white dots. Those are very normal. The neck should be short and creased with lots of skin folds. You really have to get in those skin folds and make sure that you're checking for any masses or lymphedema, anything like that. You want to turn the head from side to side. You're just assessing range of motion of the neck. The tracheal midline, make sure it's symmetrical. The chest, the clavicular fractures are the most common fracture in birth, so you want to assess for those. And then just assess for overall symmetrical nature of the chest. You're going to go ahead and assess breast development. The areola should be full, between 5 to 10 millimeters. Engorged breasts are not uncommon due to the maternal hormones, but those should subside relatively quickly. Symmetry of the nipples, make sure they're the same height. Moving down to the abdomen, you want to make sure it's rounded and relatively large due to the baby's size. Looking at the umbilical cord, obviously looking for 2 arteries and 1 vein. Palpating the abdomen like we would do in an adult assessment. You may be able to feel the liver and kidneys. assessing for any unusual masses. And then moving down to the femoral arteries, we're checking those. And then comparing them to the brachial and radial pulses. And all the qualities should be similar. Now we're moving on down to the perineal area. In a boy, you would assess the testes and scrotum. At term, the testes should be distended. Dark pink in Caucasians and deep brown in dark skin or babies of color. Looking for any kind of unusual masses. You want to assess the cremastering reflex. So the testes should elevate when you stroke the side. And at this point, it's important to note that it should always be recorded when the baby first voids. You really want them to pee within 24 hours. In a female, like we have here, you want to assess the external genitalia. In a term baby, the labia majora should cover the minora and clitoris. You may see white tinged or blood tinged discharge. Is very normal. Pseudomenses comes from the maternal hormones, and that should resolve itself. Moving on down, we're assessing anal patency, making sure the anus is patent, and you do want them to have a bowel movement 24 to 48 hours after birth. If you stroke next to the rectum, you should see retraction, checking the anal reflex. At this point, we're looking at the hips as well, checking stability of the hips, moving hips inward and outward, looking for any clicking, any signs of hip dysplasia, any signs of anything being dislocated. The Ortolani and Barlow's assessments we performed here. At this point, we're going to go ahead and gently turn the baby over. Again, assessing the scapula and the head for any signs of trauma. Now we're looking down the spine, palpating the vertebrae, making sure those are normal. You may see a tuft of sacral hair. That could be a sign of spinal bifida, so you want to make sure you note that. Assess the gluteal folds on the buttocks, making sure they're symmetrical. Asymmetrical folds could be another sign of hip dysplasia. At this point, I will be reassessing the breath sounds from the back. So just warm the stethoscope again. Gonna gently turn my baby over. And again, just reassessing any kind of adventitious breath sounds. You want to make a note of that. At this point, we're going to assess some reflexes. And we're going to stand the baby up. Stepping reflex, they should be making a stepping motion. And at this point, we're moving the baby around. We're just kind of assessing general muscle tone and symmetry as well. So just checking the muscles, seeing how their range of motion works, seeing how much muscle control they have. Those are all good things to assess. We're counting the numbers of fingers and toes and digits. Lower extremities, we're just assessing the range of motion in all the major joints. And now moving down, I'm going to perform the Babinski reflex. So tracing a backwards J on the feet, you see flaring in the toes. Perform the plantar grasp reflex, so sticking your finger under the toes, they should curl around your finger. And then the palmar grasp on the hands. Lastly, performing the Moro or starting reflex, you're just going to hold the baby and then gently kind of drop it. You should see reaction and flaring and forming a C shape with the hand. This baby is 1 day old and we've seen one wet diaper, which should be expected. Parents are taught to measure urinary output in wet diapers, so we'll continue to monitor that and always subtract dry diaper weight from wet diaper weight to get the accurate output. So this is a very healthy baby, we're happy, and we're going to continue to monitor as needed.